Is your penis a muscle? Are there muscles in the penis? Many men believe their penis is a muscle and that they could train it like an arm or a leg to have better erections. But, well, this is not true. No, the penis is not a muscle. I'm Professor Eric Allaire, vascular surgeon, specialist in men's health and erectile dysfunction. Today, we'll see what makes erections firm, how muscle help blood to fill the penis to make it firm, and how you can train or relax them to keep your erections in shape. First, I want to make it clear the penis is not a muscle. I mentioned muscles, but you will see why. Anatomically, the penis is a sponge, not a muscle. A sponge connected to the blood circulation by arteries that bring blood in it to make erections, and veins bringing back blood to the general circulation at the end of the erection. The process of making blood arrive into the penis and the process of retaining blood for the erection to last, however, is driven by muscles. In fact, firmness comes from blood pressure inside the penis when the blood gets trapped there. However, it's not about muscle compression, it's about vascular filling. It's a bit confusing. Where are the muscles in erections? It is important to know where the muscles are involved in erections, what sort of muscles are they, and how you can train them to have better erections. There are two types of muscles that are important for erections with different roles. First, voluntary muscles you can control. That's why we call them voluntary, like the muscles in your arm. And second, involuntary muscles you cannot control, but you can help them to be more efficient for your erections. Let's look at both. Voluntary muscles, pelvic floor. They are the muscles you can contract consciously. They are located at the basis of your penis, in the pelvic region. They're just behind the testicles, underneath, in the middle. You can feel them contracting if you try to stop urinate midstream. Their name is bulbocavernosus and ischiocavernosus muscles. Very nice names in it. They get contracted repeatedly during ejaculation at the climax of orgasm because they help expel the sperm out of the urethra during ejaculation. They also help increase penis firmness. It is very important to realize that you have muscles you can feel and contract because, of course, you can train them to have better erections. I tell you how you can train your pelvic muscles to strengthen your erections with the Kegel exercises. Lie on your bed or sit just on the edge of a chair, that's better. Put two fingers behind your testicles in the middle just before the anus. Contract as if you wanted suddenly to stop urinating. Contract those muscles for 3-5 seconds, then relax. Repeat 10 to 15 times, several times a day. In weeks, you will improve the control of your erections. If you have ED, Kegel exercise may help. In men with mild, limited venous leakage, Kegel exercises may be able to stop certain leakage because sometimes those leakage are embedded in the bulbocavernosus and ischiocavernosus muscles. So when you contract them, somehow you can squeeze the vein and limit the leakage. Now, let's talk about involuntary muscles and how you can improve their function for better erections. We're talking about the so-called smooth muscles. It's a very particular subset of muscles in the whole body. Those ones, you cannot contract them. And it is a good thing because when they are contracted, you cannot have erections. Let's explain. It is in fact very simple. I'm a surgeon and I can understand smooth muscles. And you know that surgeons only have 3 neurons, one for the forceps, the other for the knife, and the third grab banknotes, of course. So let's use my 3 neurons to explain. The muscles I'm talking about, the smooth muscles, are in the arteries of the penis that bring blood to the penis to make erections and around the small holes in the spine. When you have no erections, that your penis is flaccid, arteries and holes in the sponge in the penis are contracted. This contraction prevents blood from coming into the penis, and so there is no erection. And this is why men do not have erection most of the time in the day, by the way. For an erection to develop, these smooth muscles need to relax, to stop being contracted for blood flow to enter the penis and erection to develop. So, listen, this is a paradox. Erection comes from relaxation, not contraction of those particular muscles. So don't try how to contract them. It is impossible with your willingness, and you will not do it because it would be a disaster for your erections. When these muscles relax, arteries open, fill up the sponge, veins are compressed, trapping the blood inside, the penis becomes firm, not thanks to any muscle contraction by blood pressure. So, if relaxation of those muscles is key for erections, how can you help? In fact, and this is the good news, you can take actions to improve relaxations of those muscles and have better erections. For this, you have to understand what helps relaxation and, on the contrary, what degrades their relaxation. You will do whatever helps to increase production of a gas called nitric oxide in your penis. Its nickname is NO for nitric oxide, because it is the production of NO that makes those muscles relax. By the way, scientists forgot Ignaro and Murad were awarded with the Nobel Prize of Medicine in 1998 for discovering this process in the vascular system. So, what is bad for NO production in penis vasculature and relaxation is bad for erection? The bad is stress, body oxidizing components, smoking and other drugs, poor sleep, sleep apnea, diabetes, hypertension, hypercholesterolemia, pollution, exposure, there are many. The way to help is preventing all these bad things to be in your body and relaxation to be promoted: sleep, sport, stress management, antioxidant nutritional supplements like vitamin C, D, E, omega-3 acid. All these actions will improve relaxation of your muscles in the penis and promote good erections. So talking about penis and muscle raises a paradox. I name it the paradox of erections and muscles. So yes, erections depend on muscles, but not the way you think. There is no muscle, your penis is not a muscle, but there are muscles you can control directly. This is the pelvic floor, help maintain erections. You can train them with the Kegel exercise. The muscles you must help to relax, on the contrary, not contract. You can help by healthy lifestyle, stress release, control of your health. In conclusion, the penis is not a muscle. It is a blood container with tiny, smooth muscles inside. You can have muscles to protect your erections, take care of your vessels, manage your stress and your mind. If you found this video useful, like it, share it and subscribe to learn how to preserve your erections in the long term. You can also visit our website www.drallaire.com and get our free 30-page guide, Reconnecting Men to Life, explaining erectile dysfunction and how to recover natural erection. Thank you for watching and goodbye.